Thank you for joining us for Evidence-Based Practice, the steps, importance of literature review, and difference between research and quality improvement. My name is Kelly Schweitzer, and I'm the Director of Continuing Education for the Ohio Nurses Association, and I'm thrilled to bring Inga Zavenskas, or Dr. Inga Zavenskas, the Assistant Director of Evidence-Based Practice Clearinghouse at the Fuld Institute for EBP, to discuss with us evidence-based practice today and these differences between research and quality improvement. For this presentation, there is no conflict of interest for anyone with the ability to control content. In order to receive contact hours for this, you need to view the entire presentation and submit an evaluation form. The expiration date for this content will be December 1st of 2021. Our outcome for today is that every learner will self-report and increase knowledge related to the differences between EBP research and QI. Welcome, Inga. We're so excited to have you with us today.
Thank you, Kelly. So excited to be here, to be able to tell you a little bit about evidence-based practice. I work over at the Ohio State University College of Nursing at the Helene Fuld Health Trust National Institute for Evidence-Based Practice in Nursing and Healthcare. And evidence-based practice is something that I'm really passionate about. I've had the privilege of working with numerous teams in various hospitals within Central Ohio and to help them learn how to advance evidence-based practice in their organizations. So I'm really excited to be able to talk to you today. So we have some learning objectives today. By the end of today, I'm hoping that you'll be able to describe the 7 steps of evidence-based practice. You'll be able to illustrate to be able to talk about the importance of the literature review and how that really guides your practice change. And then lastly, you want to be able to compare evidence-based practice, research, and quality improvement. So first, let's talk about what is evidence-based practice. What's the definition? Well, really, it's the combination of 3 things. First of all is you want to look at the best research evidence. You also want to consider the clinician expertise, and that is based upon all of you have clinical expertise where you work based on your years and years of experience, and that's a second component of evidence-based practice. And lastly is patient preferences. Before we talk about making a practice change, you want to have a chance to speak with your patients, your clients, about what they prefer. For example, I'll give you an example. When I was a nurse practitioner and I was looking at the best medications for treating high blood pressure, and there was a new combination drug that came out that was extremely expensive, and that was indeed evidence-based. There was research findings that supported that. But when I went to have a conversation with my patient, the cost of that drug was really astronomical, and it was not something that was going to be feasible for that individual. So that's an example of how we talk about patient preferences, how that's a part of EBP. It's not just the research and your clinical expertise, but you also need to talk with your patients and your clients to see if they are willing and able to engage in evidence-based practice. So why EBP? Why do we care about evidence-based practice? Well, there are a couple of reasons. First of all, it's does have an impact for patients and our families. We have better patient outcomes. There's research evidence that demonstrates that. When we engage in evidence-based practices, our patients do better. Our patients and families are more satisfied with care because they're receiving best practice. We also reduce variation in care. Care is similar across various sites and units. If it's best practice, then it should be the same no matter where you're practicing. And lastly, oftentimes when we engage in evidence-based practice, we reduce healthcare costs. We end up reducing waste, and our patient outcomes are better. We also have evidence-based practice also is beneficial for nurses. We know that it increases nursing empowerment. The research literature shows that. I've always enjoyed working with various groups in evidence-based practice projects. Oftentimes when the nurses take on a leadership role, they feel really empowered that they have the ability to improve practice at the bedside. And when they come to meetings or when they engage with leaders and they have the research evidence that explains why we should make a change in practice, it's very empowering for them. They realize they can improve care and they have the knowledge to be able to do that. And oftentimes because of that, it ends up reducing the nursing attrition or turnover rate. Sometimes nurses, they may feel a little bit burned out and they continue to work in environments that may not be as stimulating. And oftentimes when they get involved in evidence-based practice or project, they have this excited renewal and excitement for their profession. And so they end up getting really engaged again in their particular practice setting, and they're less likely to leave the unit. That's been something that I've seen, which is terrific for nurses as well. So it benefits our patients, our families, as well as ourselves within our profession. There are numerous models of evidence-based practice. This is a list of 8 that I could find. All of them have different strengths and weaknesses within them, or they highlight different things, let's say. So something to be aware of. You probably should take a look at what evidence-based practice model your organization uses. Oftentimes your schools of nursing will also cover these within your classes. Some of them highlight more of, they're more highlighting organizational change for EBP, and other ones are more geared for implementation. So just some things to note when it comes to models of evidence-based practice. So what are the 7 steps of EBP? You'll notice these are numbered 0 through 6, but indeed there are 7 steps of EBP, so I don't want that to be too confusing. So the first step is to cultivate a spirit of inquiry, really asking the whys. Why do we do something in practice? The second step is defining your clinical question in PICO format. The third step is searching for best evidence. And then you want to go ahead and critically appraise those studies for quality. Then you want to integrate that evidence into your practice, evaluate the outcomes, and lastly, disseminate the outcomes of your evidence-based practice change. For purposes of today, we're basically going to go through steps 0 through 3 on this list here. And that really helps us to delineate the differences between EBP, QI, and nursing research. So that's the extent of what we'll get through today. But when you actually go to implement, then you will be engaging in steps 4, 5, and 6. Grace Hopper said, the most dangerous phrase in the language is, "We've always done it that way." And I think that's something that really we need to encourage our nurses to do. Oftentimes it seems like the new nurses or your nursing students are really good about asking us, if you're serving as a clinical preceptor or as faculty, or just an experienced nurse on your unit, they will ask you, well, why do you do that? And I think that's part of our responsibility as nurses, to be able to explain the evidence behind the practice. And if you don't know the evidence, then to go look it up and maybe take that new nurse with you. So that's part of that spirit of inquiry, being able to ask the whys. Why are we doing something? For those of you that are in a teaching environment, it's also a great way to engage with your medical residents or other students in your area. Ask them if they're prescribing something new or writing a new order for you. Ask them what are the factors that contributed to making that change, to writing that particular prescription or that particular order for your patients. And that way you will get to learn a little bit more about their expertise and also maybe the research behind that practice. As a nurse practitioner, I would keep a little Post-it note in my pocket about various things that I wasn't sure of, and I try to make a point once a month at least to go look things up. So I would also suggest that for you in your area of clinical expertise, to make a note of different things that you're curious about and go look them up when you have time. So step 1 or actually I guess it's step 0, but in this particular model, it's numbered as step 1. You want to define your question in PICO format. We like to joke with PICO that it's like a French word, that the T is silent. So obviously it's not French, but PICO is an acronym. So the components of PICO are: the P stands for patient or population, the I stands for intervention or issue, the C is comparison, the O is outcome, and T is time. T is not always used in all PICO questions, so it may or may not be relevant to your particular clinical question. And there are a number of templates that exist for writing PICO questions. I would strongly suggest that you use those, because basically you can't go wrong. If you use a template and plug in your various PICO components, that will really help you with searching the literature. So just to give you an example on this particular slide, there's an intervention question template here. And the format for that would be: in a certain patient population, how does X compared with Y affect some sort of patient outcome? May or may not, the time part may or may not be relevant. Time could be within 30 days. It could be related to rehospitalization within 90 days or within 30 days. So you may or may not have the T, but the main things you want to have are at least the P, the I, the C, and the O. One of the my aha moments when I was first learning about evidence-based practice is the little bit of confusion about what is the purpose of a PICO question. It's really just to guide your healthcare literature search within the databases. It's not your actual project. So PICO is really a tool to get you into the literature. And the way that works is you combine the different components of the PICO question when you're searching in your various databases. So just to kind of make note of that oftentimes your outcome of your project may be much broader than what you go to search the literature. It may be different, it may evolve. But PICO is just a tool to help you search the literature. So that was kind of one of my aha take-home things that I had learned when I was first engaging in evidence-based practice. So the next step of EBP is to search for best evidence. So continuing along with our intervention question, you'll want to look for the best evidence to answer your particular question, your clinical inquiry. So this particular slide here, the best, most rigorous, strongest level of evidence, if you're talking about comparing an intervention like X versus Y, you'd want to find a meta-analysis or a systematic review of randomized controlled trials. And basically what a review of randomized controlled trials, that is a combination of a bunch of different RCTs together. Someone has gone through those and combined all of the results together for you. If they have done that, like essentially mathematically, if there's a numerical outcome, then that's something called a meta-analysis. And so rather than looking at individual study results, 1 or 2 studies, they combine them all together and give you an effect size for the overall effect of combining all of those results together. So it's really powerful for practice. It gives you a very good answer. If you're lucky enough to find a meta-analysis that answers your particular clinical questions, that's definitely your most rigorous evidence for an intervention type question. If you can't find a meta-analysis, then try to find a systematic review of RCTs. A good place to look for those is the Cochrane database. That is a particular database that is really the gold standard for finding systematic reviews. If you can't find a meta-analysis or a systematic review, then you go on to individual studies. And in this case, you'd look for a randomized controlled trial. So basically where you have your particular patients or the people in your study that they would be randomly allocated to either the intervention or the control group, you would randomly select your sample from the entire population. So those are different elements of a randomized controlled trial. And then if you can't find an RCT, then you would look for a well-controlled, non-randomized experimental study. So that would be like a controlled trial without randomization. So sometimes if you're working in, for example, in a hospital setting, you cannot randomly allocate the intervention. Sometimes you just have to work with what you have in your particular setting. So you may not be able to randomly. You might have to work with whatever unit is willing to engage in your intervention. So in that case, your intervention wouldn't be randomly assigned. So that you could still conduct a research study, but it wouldn't be a randomized controlled trial. It would be a controlled trial without randomization. Your next step after you design your PICO question, you're going to search for best evidence. And I would definitely recommend searching in multiple databases. I would suggest starting in PubMed, looking in CINHAL. You could also look in ERIC, which is if your particular clinical question or PICO question is related to something with education, you might want to look in that. You could also look in PsycInfo if your PICO question is related to some question related to psychiatric nursing. I definitely recommend, again, looking for meta-analysis or systematic review, and by all means consult a medical librarian. They are the superheroes of EBP. They are fabulous. And regardless of no matter how much experience you may have in EBP, it's amazing how you can always learn from your medical librarians. So by all means, if you have access to one, please consult with them when it comes to searching for best evidence. So how do you know if the evidence is good quality? I will tell you, just because something is published doesn't necessarily mean that it's good. So be warned about that. So how do we figure that out? Well, the way you do that is you appraise the studies for quality. You want to find out, are the results valid? You want to look at what are the results? And really, most importantly, will the results help you care for your patients? The way you appraise studies for quality is use a tool. There are many, many appraisal tools out there for quality. Use those. There's specific questions for research design, and take a look at those particular tools to help you determine if something is a well-conducted study or not. Then what you want to do is summarize. Once you have appraised your study, you're going to want to summarize what you found in that particular paper, that published paper. This is an example of different headings. Oftentimes, I think it's helpful to summarize various studies in a table format. So these are examples of headings that you could use within a particular table. So you'd first want to have the citation. You'd want to indicate what level of evidence it is, the sample and the setting, talk about the various variables they looked at. What were the outcomes? The outcomes in your table should match what your PICO question was. How did they analyze the data? And then what was the quality of the evidence? Oftentimes people will ask me, what about the quality of evidence? How do I help determine that? That's really quite subjective. And oftentimes what you'll want to consider are the strengths and limitations of that paper. Oftentimes you'll find that within the discussion section of the paper, the authors will actually tell you what are the strengths and limitations. You also need to consider what's the risk or harm of implemented. Sometimes harm could also be considered what's the cost of implementing a particular intervention. It may sound amazing, but it might be really, really expensive and something beyond what you may be able to do in your particular institution. And that relates also to feasibility. Do you think you'll be able to get support for that particular intervention, let's say in your institution? Are there other competing priorities right now? Those are really subjective things. They're going to be unique to wherever you're practicing. And so really the quality of evidence is your personal opinion about your ability to be able to use this particular paper within your practice. Then this is an example of a completed summary table that I've included here for you. So here's here you see the various headings up at the top, and these are basically the different aspects from one particular published paper. Really try to limit a summary table just to 1 page per study. It's really supposed to be like your Cliff Notes for taking a look at something very quickly. And so you don't want your summary to be super long. You want it to basically provide the high points for a particular paper. It's a resource for you to be able to answer any questions if you were to go to a meeting, or just as a way to keep your various thoughts organized. After you've summarized individual papers, then you need to synthesize the evidence. And synthesis is different than describing or summarizing the papers. Really, the purpose of synthesis is to be able to explain what's known, what's consistent across all the studies. What have you learned from looking at all the various papers that address your PICO question? And maybe possibly what is not known. And if you've identified something that is not known, if you're not seeing a lot of similar findings addressing your PICO question, you might have identified a gap. And that might be an opportunity to conduct research. But synthesis is different than just summarizing the studies. You really have to think about what all the studies tell you together as a group. So how do you do that? Well, you use your evaluation table and you look for commonalities across the studies. This is where it's really helpful in that particular column with the outcomes. If you report your outcomes in all the same way for each particular paper, it'll be a lot easier to try to synthesize the findings across studies. And so for me personally, that works very well. You can try to summarize them narratively as well in sentence format if that works better for you, but I personally like tables. A strategy for using those tables is to number them. So for example, add legends, like you can number the papers 1, 2, or 3, or just use the author's last names. And that's a technique for trying to keep the particular tables short. You don't want them very, very long. So here's a little analogy down at the bottom for synthesis. So peanut butter itself is awesome and chocolate is awesome, but when you combine them together, you get a peanut butter cup. Now, a peanut butter cup is not the same thing as peanut butter or chocolate alone. It's incredibly more delicious when those things are combined together. So similarly to summarizing individual papers, paper 1 may be great and paper 2 may be great and paper 3 may be great. But when you combine them all together, you get something really unique and different and much better because you really have synthesized what everything tells you together. So I just wanted to give you a couple of examples of synthesis table. This is, this is the levels of evidence synthesis table. So this gives you an overview of all the different levels of evidence that we found for our particular PICO question. This particular table is looking at levels of evidence for looking at preventing central line associated bloodstream infections. So in this, if you look at the levels of evidence on your left column, we have levels 1 through 7 listed here. And what's nice about this table is you get a nice overview of what we were able to find. So if you look at column or number 6, the paper by Ista et al., we see that that was a systematic review, and it included 79 studies, which is very, very rigorous, just based on the quantity that they've looked at. Then we also found one randomized controlled trial. That's the paper by Noto et al. In column 7. Then we had one level 3 paper, which was by Septimus et al. We found a couple case control or cohort studies in columns 2 and 3 by Al Abdelli and Alvarez Moreno. We found one systematic review that included descriptive studies, and that particular systematic review included 34 studies. So again, pretty comprehensive in scope, but because it included descriptive studies, which is lower on the levels of evidence, it dropped down to a level 5 rather than a level 1 systematic review, because it included descriptive studies, it was not just limited to RCTs. And then lastly, we found one individual descriptive study by Marshall et al. So if you look overall at this particular picture, you get a gist of the levels of evidence that addressed CLABSI in this particular example. So all in all, again, this is somewhat subjective, but it seems to be pretty high level, especially because we found that systematic review with 79 studies. And so that gives you increased confidence that you know that there was a fair amount published about this particular topic, and that it appears to be a pretty high level of evidence. So this is an example of a synthesis table. You can either synthesize the evidence for interventions or outcomes. This particular table looks at interventions. So basically we were looking at various processes or interventions to prevent central line associated bloodstream infections. So if we look at, these are the same 7 papers that were in the previous slide. So for example, we look at the first recommendation, the first intervention is a central venous catheter bundle. If we look at the 7 papers, 4 out of the 7 papers recommended that as a best practice for preventing CLABSI. So all in all, you might be fairly confident. It looks like that might be something we might want to engage in our particular institution. I like to color code these because when I color code them, the green cells indicate that it's had a positive effect. But again, this is, however, the table is beneficial for you to tell the story about what you found within the evidence. So these are different examples of, again, interventions, and it gives you an example of how you might recommend interventions for best practice within your particular organization. Now, in contrast, I wanted to give you an example of an outcome synthesis table. So these are those same 7 papers, and what they took a look at was infection rates within CLABSI, and they looked at cost. So if you look at the 7 papers, a down arrow indicates you had a reduced infection rate. So if you look at the various papers 2, 3, 4, 5, and 6, when they had implemented those various best practices, they ended up reducing infection rates. So all in all, it appears that some of these CLABSI best practice interventions do reduce infection rates. In addition, the paper by Ista et al. Also saved in costs, which is another terrific thing. I added that 3rd row there that sometimes, just to help remember the statistics, for example, if you were in a meeting, that we ended up, it looks like the average cost of one CLABSI that was cited in that paper was about $42,000. So you can imagine that even if you're lucky enough to prevent one CLABSI with implementing a bundle, you've potentially saved your organization $42,000. So that is one way of helping to tell your story. So you can see the differences between an intervention synthesis table versus an outcome synthesis table. So now we're going to talk about why is that literature appraisal so important. And this is really where you come to the crossroads when it comes to evidence-based practice versus research. If you have enough good quality evidence to change practice, you go down the evidence-based practice route, and you would feel confident if it's good quality and you have enough rigor in your evidence to go ahead and change practice. If you don't have enough quality evidence to change practice, well, then you've potentially identified a gap, and you might want to go down the research road, or you could potentially think of an innovation. But this is really why that literature appraisal is so important, because you want to be able to look at the rigor, the level of evidence, as well as the quality. And that helps you feel more confident in making a recommendation for practice. Donal Omatuna had written this one particular sentence in an evidence-based practice book, and I really liked how it described the difference between research, evidence-based practice, and quality improvement in one sentence. And so I've highlighted that sentence on this particular slide. So research is focused on generating evidence for practice. EBP is focused on implementing evidence in practice, and evidence-based quality improvement is focused on evaluating how well the practice is working. So these are subtle differences, but you can see how they are indeed different. So just to give some key points about differences within those three particular areas of inquiry. So first, we're going to talk about research. Research really helps you determine what is the right thing to do. The goal of research is to generate new knowledge for a particular scientific area of inquiry. It can use a quantitative or qualitative methodology depending on your research question. Quantitative is based on numbers. Qualitative uses words, usually as data, or it could be observations, things like that. Research is based on theory, and oftentimes it's directional. The research scientist will have a hypothesis. They believe that there's a relationship between two different particular variables, and they feel that maybe one is positive related or negative related to another. Research, the whole point of it, it's designed to be generalizable. When researchers engage in a particular area of inquiry, they hope to improve science. They want to do something of benefit for the greater good. And so because of that, they really want to make sure that the findings are applicable anywhere beyond just their particular institution where they implemented the research. Research involves a certain element of risk because we don't know potentially what the outcomes will be when you study something. So it definitely requires institutional review board approval. That's IRB. And the IRB will take a look at your research proposal to make sure that patients are not unduly harmed when you engage in research. So that's something very unique to research, and that is absolutely mandatory, must be done prior to engaging in any sorts of research. And then oftentimes research is funded by public and private entities. And oftentimes, I say sometimes because many of us will apply for grant funding and sometimes we don't receive it. But because research is so rigorous and there's so many controls around it, it can be expensive. And so it's very helpful if you're able to get funding to be able to support that type of endeavor. Next, we're going to talk about evidence-based practice. And that really asks the question, are we doing the best thing in practice? So some key points about evidence-based practice. It helps you to, you want to use the best available evidence to make the best decisions. So it uses two types of evidence. You can use internal evidence within your organization or community. So for example, that might be looking at internal outcomes within your organization, particular data, rates of infection, rates of satisfaction, things like that. And then you also want to look at the external evidence. And that's where you're looking at the body of published literature. That would be things, for example, that we talked about earlier, going into the various databases to be able to find what other people have found about your particular area of inquiry. So EBP involves looking at internal and external evidence. EBP summarizes the body of evidence, so you're going to look at what you find overall within the entire body. It's not based on one or two studies. You have to look at all of the evidence together. The purpose of EBP is not to generate new knowledge. You basically want to implement what's already been done because you've already established its best practice. So you're not generating new knowledge, you're implementing what the researchers have already done. Because of that, it's not generalizable. It's unique to your particular setting. However, that being said, some of the things you learn when implementing evidence-based practice could possibly be transferable to another setting. You can certainly learn from what other people have implemented. An interesting thing about EBP, it certainly requires review because oftentimes you're collecting data, your outcomes data, but may or may not require institutional review board approval. And that's going to vary at the organization depending on where you work. Some hospitals or practice settings do require IRB approval for evidence-based practice, others do not. So you want to check with your particular organization where you're going to implement your evidence-based practice project. And oftentimes EBP is funded from within the organization, but sometimes you are able to get funding from outside sources. That's becoming more and more available. It's more popular these days. So certainly when it comes to implementing a practice change, take a look at various funding opportunities for evidence-based practice projects. So EBP really helps you cross the bridge between the research findings, what a scientist will find, and it helps you implement those into practice. So it's implementing the research into practice. So then what about evidence-based quality improvement? That really asks the question, are we doing the best thing the best way every time? It really has to do with consistency. Some of you may have heard of some of these common models and terminology in QI. Many nurses are engaged in the Plan, Do, Study, Act, PDSA. Many of you have heard of that. Some of you have heard of Six Sigma. These are various QI models. And you'll notice that the QI models are very different than the evidence-based practice models that we talked about earlier. So QI really focuses on evaluating a process and it tracks outcomes data. Ideally, it would include a literature review. So you're implementing what we already know as best practice. QI is also organization specific because you're looking at outcomes data specific to where you work. And so because of that, it's not generalizable to other places. QI, because you're dealing with data, again, will require some sort of review, but usually not IRB approval. And again, that would vary by organization. It's going to depend where you work. And QI, nearly always the funding comes from within the organization because you're trying to improve some sort of a practice within your organization. So because of that, it's being funded by where you work. So now we're going to talk about some case studies to help really explain some of the differences between evidence-based practice, research, or QI. So this first case study is about the staff in the pediatric oncology ward, and they've noticed an increase in central venous catheter port occlusion. And the problem is when that occurs, it requires removal and replacement, and that delays chemotherapy treatment. And so the nurses wonder if CVC flushing methods may affect occlusion. So they form their PICO question and they search the literature, but there isn't much there. They did find one study that found an association between port occlusion and flushing. And so they wonder, in children with a CVC port, does using single-use pre-filled syringes compared to manually prepared syringes decrease occlusion rates? So right now, I'd like you to pause your webinar, take a second to look at the slide and think about it. And what elements in here do you think are EBP, research, or QI? Okay, hopefully you've had a chance to pause and think about it. Looking at the last bullet, if you notice, there's a directional question there. They are asking about pre-filled syringes compared to manually prepared syringes, and does that decrease occlusion rates? Decrease is a direction, and that is sort of a hint that this is a research question. If it's an EBP project, the verb there would be affect occlusion rates. It could increase or it could decrease, but when you look at EBP, you have to be open to that the research findings could go either way. In this case, they're really essentially testing a hypothesis. They think that those pre-filled syringes are going to decrease occlusion rates. In addition, we talked earlier about looking at the body of EVP. In this particular case, they only found one study. Well, I don't know about you, but I wouldn't be all that confident about changing my practice based on one study. And so really, I think what they've done here is they've identified a gap. It's a great question, really practical. And so what I'd recommend at this point is trying to connect with a nurse scientist, maybe someone that could help you with implementing and actually writing a research proposal and going through and doing that. So some of the elements you can see are similar. There's definitely a spirit of inquiry here. They're asking and they search the literature. But ultimately, when we talk about the fork in the road, they didn't have enough high quality evidence to answer their question. What they did was identify a gap. So this is really a research case study in this particular case. So I hope you guys had good luck with that. Let's go on to the next one. The next case study. Okay, this is an ICU staff, and they are struggling to reduce central line associated bloodstream infection or CLABSI rates on their unit. And so they're wondering about the best way to clean and access central line ports. So they form a PICO question and they go search the databases. They find a body of evidence that suggests use of alcohol impregnated caps is helping to decrease CLABSI rates. So they talk to their unit manager, the business office, and QI team. And so they decide to implement alcohol-infused caps on all central line ports. They monitor nurses' use of caps on all central line ports, they conduct chart audits, and they track the outcomes. So what do you think? Is this EVP, research, or QI? Put the webinar on hold for just a second. Take a minute to think about it, and then we'll be back in just a minute. Okay, so this is a little bit tricky. What do you guys think? There are some elements of a few things in here. They did form a PICO question, right? And they searched the databases, so that's terrific. And they found a body of evidence, right? Which is great. So they were able to answer their question. They were able to figure out what's best practice. However, if you take a look, there's a little bit of a clue here. They also consulted, in addition to their unit manager, they also consulted the business office and the QI team because they wanted to make sure they were implementing these ports consistently. And so if you notice, they were monitoring nurses' use of caps on all central line ports, and they're also conducting chart audits. And chart audits are really a classic hint that this is a QI project. So there definitely are similarities here. This is a well-done example of an evidence-based quality improvement project because they did search the literature, but they also were very closely monitoring consistency in practice, where the nurses were really following the process in practice because they conducted those chart audits and they tracked the outcomes. So this is an example of a QI project. But again, you can see that there's elements of both. So this is why sometimes it's a little bit confusing and why it's helpful to work in teams with these various projects. So here's a third study. A nursing student asks staff nurse about offering a distraction intervention to help children cope during painful procedures during hospitalization. The unit's patient and family satisfaction scores have not been meeting desired national benchmarks. So the nurse discusses the opportunity with her manager, who is concerned about the amount of resources this distraction intervention will require. The nurse wants to see whether or not this distraction intervention has been tested in other hospitals. She forms a PICO question, goes to the literature, and finds a large body of good quality evidence that shows that the distraction intervention improves patient and family satisfaction. She takes her evidence tables back to the manager and works to get approval to move forward. Okay, so once again, I'm going to have you guys pause the webinar for just a second, take a minute to think about it, and then we'll be back and we'll discuss whether or not it's EVP, research, or QI. Okay, welcome back. What do you guys think? So if you take a look at, she certainly has a great, she or he, the nursing student, has a great spirit of inquiry. There's definitely a relationship to, as far as there's a great spirit of inquiry here. They're asking the question, also using some internal data that notice that they haven't met national benchmarks. They go to the literature, they form a PICO question, and they found a large body of good quality evidence that was a great match to their particular PICO question. They found that the distraction intervention improves patient and family satisfaction. So do they really know, and do they need to go conduct another research study? Well, probably not. They have good quality evidence, right? That's what the literature review showed, and they feel pretty confident. So this would be an example of an EBP project. We didn't take this project, this particular case study, further along in the process. And certainly, ideally, you could use elements of QI, but as of the level of detail we have right now, I would say this is probably an example of an EBP project. But I will tell you, the way we're moving forward currently is really to use evidence-based quality improvement. That's really the wave of the future, is to combine those two methods together. So that's why I wanted to take an opportunity to highlight some of these key points today. So just very quickly to summarize, we developed a little table here that gives you just some key highlight points about the differences between research, EBP, and quality improvement. So research asks, what is the best thing to do using the scientific method? The nature of your question is usually directional. You'll use words like increase, decrease, or improve as you ask the question. So it's directional. It often rises out of theory. There's some sort of theoretical background about why you're asking that question. The particular technique in research is very prescriptive. It's very rigorous. There's no room for changing your protocol. Once you've written the research protocol, you have to stick to your research protocol. Otherwise, you have to write an amendment to the Institutional Review Board. So it's very strict with that. So you always need to have Institutional Review Board evaluation and review. And the reason for that is to protect human subjects, because you don't know what your particular, what the results will show. And it potentially could harm patients. So they have to be aware of that. And the goal of research is always to generate new knowledge. So that's very unique. Research has a very unique methodology. Then going on to EBP, that really asks the question, are we doing the best thing? It's not directional. When you go to search the literature with using your PICO question, the verb within your PICO question is neutral. The particular verb, for example, would be like, how does X compared to Y affect some sort of outcome, or how does it influence some sort of outcome? You have to look at the literature and realize that you can't strictly look at the particular research results that support the finding that you want to see. You have to be willing to look at, to be neutral, to look at both sides of the coin, so to speak. And often, if you notice, the PICO question is past tense. So it's usually compared to. Compared to indicates past tense, because the research has already occurred. In research, your research question is in the future tense. What will X versus Y decrease? We don't know the answer yet. So that's why we're researching it. With EBP, your PICO question is past tense. We already should know the answer to that. And that's why, so that's a key difference between the two. The nature of the question, it really rises out of clinical inquiry. Based on my experience, I will tell you the clinical staff ask great questions. Why do we do X in practice? And if I don't know the answer, by golly, then it's my obligation to go there and find out what that is. So they're terrific at that. So don't lose that spirit of inquiry. Always ask why. And it's really geared towards outcomes as well. Another key difference is that EBP has some really specific models, which again are within this particular presentation earlier. For example, the ARC model is really an organizational model. There's the IO model, Rosworm, Larrabee, Johns Hopkins, etc. So it has some really unique evidence-based practice models. It does require some sort of review, and that's going to depend on your organization, basically because you're collecting organizational data. And by all means, before you take your evidence-based practice project and go to disseminate, meaning you want to present your awesome findings outside of where you work, make sure you have permission to do that, because just because you have access to data doesn't necessarily mean you have the right to go and present that outside your organization. And the goal of EBP is really to implement evidence in practice. You want to take what you've learned, what is best practice, and implement it and make some sort of change and improve care where you work. And then lastly, we have quality improvement. So that really asks the question, are we doing the best thing right? Are we doing it consistently? It is directional, so it will use words like increase, decrease, or improve. That's similar to research, so you can see why there can be confusion between QI and research. It usually rises out of a need to fix problems. So for example, there'll be an increase in high nursing turnover, something like that. But there's usually something an impetus for why you want to engage in some sort of a project. And it really tends to focus on the process. Are we doing something consistently? It has its own unique techniques. For example, like that plan, do, study, act. You can also use Six Sigma. Some of you may have heard of lean processes. And also the way it tends to present data, it tends to use dashboards and scorecards. Those are very unique to quality improvement techniques. And again, when it comes to conducting these various projects, you definitely will want to have someone review your project. And it may be more than just your nurse manager, again, because if you are taking data and disseminating it outside your organization, make sure you have permission. Just make sure that somebody higher above knows that you're going to do that. And really the goal of evidence-based practice is to help us improve care. We want to make sure that we're consistently engaging in best practice, we continue to improve care, and we're doing those things. We're not falling back on old ways, things that we've done it. So you can see how some of these three particular areas can overlap, but they do have some unique components as well. So oftentimes it helps if you're not sure about a particular paper, whether it's research, EBP, or QI, it's really helpful to talk about these things with a particular mentor or maybe someone else in a team setting. So if you're not sure, just ask. But there are some unique components to each of these. So I hope this table here was able to help you delineate the differences between research, EBP, and QI. So today we talked about the definition of EBP. We briefly went over the 7 steps of evidence-based practice. We also talked about the importance of the literature review, and basically that really helps delineate whether or not you're going to go down the research pathway or the evidence-based practice pathway. That's why that is so critical to really do a good job with your literature review, because that'll help delineate which way you're going to go. And then lastly, we just highlighted some differences between research, evidence-based practice, and quality improvement. There are subtle differences, but the more you engage and look at these processes, you will see how they are different. I really appreciate you taking the time to listen to me today. I hope that this has been helpful for you. By all means, please feel free to reach out to me. If I can advance the slide. And feel free to email me. My email is zadvinskis.1. That's a long name. It is spelled ZADVINSKIS.1@osu.edu. I'd be happy to answer any questions, or if you have any comments about how we can improve this program, we would greatly appreciate it. Again, thank you so much for your time today, and good luck as you engage in your own endeavors to improve practice where you work. Thank you.
Thank you, Inga. And for those of you listening to the webinar, please complete the evaluation that's needed in order to receive your contact hours. And we look forward to your comments as well as to what we should do for future programming. Thank you.